are you today?
Hi, how are you? I'm okay.
All right, I'm Alicia. I'll be your occupational therapy student today. We're just going to be going over a few things task-wise for your dressing and everything. Before we get started, do you have any pain today?
Not too much. I had pain medicine about 30 minutes ago, so I'm feeling okay right now. It's really low, very manageable.
All right, that's awesome to hear. That way we can go ahead and get started with these activities. So what we're going to be doing today is we're going to be doing lower body dressing. So I see that you're already in this chair here, but if it's possible, I'm gonna have you get over into this chair that has a stable back with arms as well, so that way when we're dressing, and I know you said you're a little bit fatigued, that way you can take rest breaks in between as well.
Okay.
It don't have to be like a complete one-step job, okay?
Okay.
All right. So I'm gonna just move this chair. I'm gonna eventually bring it back up once we get there. But what I'm gonna have you do is if you can just bring your legs back for me, so then that way we can sit in position to stand.
Sorry, my legs feel a little heavy today.
You're fine. I got y'all help you out with that. And then have you saw a gate belt before?
Yes, I believe so.
All right. So yeah, just a reminder, this is just for my safety and your safety. That way when you get over to this other spot, that way you can get safely to that position in that chair, okay? All right. And I'm just gonna come around you here. I know you said you're a little weak, so don't worry about doing anything else. I'll do all the work right now. Just have to lift your hands out the way for me. And then we don't have any ports or anything I should be worried about with this gate belt, right?
No.
Is that too tight?
No, it feels fine.
Alright, so what I want you to do next for me is I want you to just shimmy all the way up to, try to get your bottom all the way to the end of the chair if you can. I'll help with your trunk support.
Okay.
There we go. We're just gonna make sure we're all the way at the end. There we go. And so like I said, you're just gonna get into this chair here since it has that stable back with the arms. And what we're gonna do is you're gonna give me a big old hug and then you're just gonna stand. We're gonna turn, you're gonna reach back for that chair, and you're gonna sit, okay? Alright. I'm gonna come in right here and kind of block this knee here. Go ahead and give me a big old hug, and on the count of three, we're gonna go 1, 2, 3. There you go. And then we're gonna stand. I want you to reach back for that chair. Alright, good job. Okay. Just making sure your legs are good. Alright, how do you feel?
I feel okay, a little tired, just trying to catch my breath.
Okay. As long as we don't have any dizziness or anything, we should be good and to go ahead and get started with our task, okay?
Okay.
Alright, so I'm gonna bring this chair up close so that way we can kind of talk about some things of what we'll be doing today. So has anybody come in to talk to you about your condition recently?
Not recently. They have before, but nothing recent.
Okay. Alrighty, so you have a condition called relapsing and remitting multiple sclerosis. It affects your nervous system. That part of your body kind of helps you control your movements, how you feel, and think, as well as with your everyday activities and everything like that. So with this type of MS, your symptoms kind of come and go. You may have flare-ups. That's where that relapsing comes in at. And then you also can be followed by periods of you feeling better, which is the remission portion. So the good news here is that we do have treatments and exercises that have been prescribed that can help you manage your symptoms and keep you kind of pretty much moving throughout your day or whatever and with your daily activities. So as your occupational therapy student, I'll work with you to make daily tasks easier and fit your energy needs as well as what you're working on as well. Alright. So like I said, we're going to be working on lower body dressing. I know these aren't your pants, but we're just going to use a little bit bigger size pants so that way we can kind of show you what to do when you're feeling fatigue in these stages with your relapsing MS. So with these pants, we do recommend that you get like a bigger kind of, maybe a go size up or something that is loose fitting so that way you can get these on easier. I know tight clothing is a little bit challenging for those who have MS as well.
Yes.
Alright, so with these pants, I know, like I said, they're pretty big, but what I'm going to do is, it's kind of awkward, but I'm going to just scrunch these bottoms of these pants up here. And I'm just going to throw them on the ground here.
By the way, I am, just because I'm feeling a little weak, I might need a little help taking my shoes off too, but I'm willing to try my best.
Okay.
First.
I Alrighty, so again with that one, getting your shoes off and everything, I'm gonna come in and help with that.
Okay.
So this is the dressing stick, this is a reacher.
Okay.
We can also use this to get dressed with as well, but this can also be used if you take the insole here and here and you put this in the back of your shoe.
Oh, I see.
You should be able to swipe your shoe
I
off.
think I used something like that before.
Yep, and then you just
Okay.
cut your hole and then grab your heel.
Okay.
So if I can see you do that first,
Okay.
and that way we can go forward. And if you need to take a break, just go ahead and take a break, no worries.
Okay. So I use this, and then I will go ahead and slide that off.
There you go, good job.
And then I use that.
You're gonna do the same thing over there.
Yep.
And what I'm gonna do is, and if you're at home by yourself or somewhere, if you wanna just use that reacher, you can always grab them by the heels and move them out of the way, so that way you're a little bit safer and your environment is clear to get dressed and do whatever you need to do.
Okay.
Alright, so since we have those off now, I'll take this, and then like I said, if we need that, we'll bring this back. So what we're gonna do here is, I'll place your hands in front of you, and I'm gonna show you what we're gonna do. I'm gonna take my shoes off too, so that way we're mirroring each other. So since the pants have been scrunched up, we're just gonna step into them.
Okay.
Straight into on both sides. And since we do have a little bit of fatigue, I will come in and help with the assisting of grabbing, but I do want to see you use your hands and see how we're moving and everything with that, okay?
Okay.
So we're gonna take our pant legs and we're just gonna shimmy them up our legs until we get to kind of right above our knees, if that's okay. We can go up further if you need to, if you wanna kind of shimmy around in your chair, everything like this, we can do it like that,
Okay.
okay?
Okay.
And then, once you get here, we'll stand up and then we'll pull pants up, okay?
Okay.
Okay, alright. And like I said, whenever you need a break, you go ahead and determine that break. I'll be right here to assist. So I'm gonna get these pants scrunched up and ready for you to demonstrate. And since we do have those armrests on the chair, I'm gonna help you scoot up just a little bit. That way you're not kind of overexerting yourself or overbending your back out of the way. Okay? So we're just gonna scoot just a little bit up to you. Alright. These pants placed right there for you. And since you already demonstrated how to use the reacher, if you do feel fatigued while doing this activity, you can go ahead and grab the reacher. That would be something that we would use to help upgrade the activity for using the assistive device such as the reacher. So if you have your hands there,
Can I am feeling like a little weak in this area, so
Okay.
I feel like bending would be a little bit hard. Can I use this to just pull up just a little bit?
so yep, you can use the reacher to go ahead and pull up if you feel comfortable in that position.
But I got my feet in.
Okay, you have your feet in,
So
good
you're
job.
saying just grab it like this?
Yep, and we're just gonna thread it all the way through. And then yes, if you can use your hand to bring up the rest of the way, you're good, good job. And yep, you can bring them up as far as we can go up. There we go. Alrighty, and so next what we're gonna do is stand. How are you feeling? Are you able to stand? Do you feel like you need a little break, rest?
I feel okay. I might just, again, I might need a little help putting my shoes back on before we get standing, but I just need to take a couple breaks first.
Okay, alright. Take your breaks. Like I said, there's no worries with taking breaks. Like I said, with the remitting MS, you will have periods of fatigue and periods of shortness of breath. Those things usually only last about 24 hours, but in these cases, you do have the device to help, and know that it is okay to take breaks. But at the end of the day, the task will be completed, and you'll get to where you need to go.
Okay. Okay, I think I'm ready to put on my shoes again.
You ready?
So you said just grab it and get over here.
Yep. If you're gonna use the same technique, you pull it back. There you go. Good job. Okay. Awesome. scoot all the way up to the end for me if you can. I'm gonna give you a big hug, and on the count of three, we're gonna stand. And I want you to help pull up the pants. I will help where needed.
Okay.
Okay? All right, I'm gonna come in here. I'm gonna have you scoot all the way up for me. All right, good job. And on the count of three, we're gonna stand. 1, 2, 3. Okay. You can pull those pants. Don't worry, I got you. All right, good job. And you can reach back for that chair. All right. Good job. All right, how you feeling right now?
I feel okay.
Okay.
Just catch my breath.
Just catch your breath and get your feet up there. And so, yeah, that will be pretty much how you will get dressed. In those days when you have like relapsing MS, when you're just not feeling the best, but you still need to go places, still need to just get up and get out. Another way we can downgrade this activity if the fatigue is just a little bit too much, we can have the patient do this in a reclining chair or fully in the bed as well. Do you have any questions for me about anything when it comes to dressing? I know this is kind of like, yeah, but it is necessary and needed.
I think right now I'm fine. Yeah, you showed me how to use the reacher. I really like that. So
We'll keep this here in your room for you.
Yeah, I'm gonna be using that a lot more because it does make things a lot more easier on days where I'm just feeling really slow and heavy and tired. It makes it easier for me. So thank you.
No problem. And then I do want to encourage you in those days when it is feeling kind of heavy and fatigued, this is just a helper. I do want you to try to use your own arms and legs as well to the best of your ability. That way we can kind of regain that strength and kind of get past that kind of period of feeling fatigued and everything, okay?
Okay.
All right. Thank you for helping me today and thank you for being a participant.
Thank you so much.
No problem.